Hey folks, my name is Dr. Amy Pearlman. I'm a board certified urologist with expertise in sexual health, hormonal health, and genitourinary health. And I have a fellow urology colleague here with me today. Mike, say hello to the crew.
Hey, everybody. Thanks for having me, Dr. Perlman.
So, Mike, I think we met maybe like 6 months to a year ago. One of our mutual colleagues, who's a sex therapist, actually put us in contact. And you're up in the New Jersey area. So, if you can just share with everyone listening, what's your history? Like, where did you do your training and what does your practice currently look like?
Sure, I'm a urologist, and so I take care of male and female bladder issues, kidney issues. I have a subspecialty in women's pelvic health, or the term for that is urogynecology. I did my training originally at a place called Beaumont Hospital in Southeast Michigan. That's where I did my urology training, and then I spent 2 years at the Cleveland Clinic in female pelvic medicine and reconstructive surgery, otherwise known as urogynecology.
It's so funny because I'm a woman largely in men's health and you're a man largely in women's health. Like, how does that happen? I know when I think about what I do, even though I love it and I have so much passion for it, sometimes it does sound a little bit weird to tell people what I do. Does it sound weird for you?
It's not weird for me. I mean, in my residency, our chairman, when I started, was Ananias Diokno. And then after he retired, it became Ken Peters. And they're both women's health specialists. So we did a lot of women's urology, a lot of female pelvic health. And I loved just all of the medical aspects of the field, the surgical aspects of the field. And somehow I ended up here today.
So let me ask you this, because I oftentimes get asked, like, what is the role of a woman in men's health? And what is some of the secret sauce that I might bring as a woman? What do you think some of the secret sauce that you might bring as a man in women's health is?
It's an interesting question. I mean, I think we have different perspectives. And just for clarification, I still see men too. I think about 5% of my practice is male health, and I do some male sexual health, but my specialty is really in women's health. And I think just through my training, I've really learned to fully understand everything that women deal with, from sexual health issues to intimacy issues to bladder issues.
Do you think it makes us better listeners? Like, I know for me, because I don't have the same organs as many of my patients, when I ask my male patients questions, I'm legitimately asking them questions to understand what they're going through to figure out solutions. Do you think it makes us better listeners and problem solvers?
I think it does for sure. I would say it does. Absolutely.
Awesome. So today's episode, I really want to delve into bacterial vaginosis, which I know does not sound like a sexy topic to talk about, but it's actually very relevant to two patients I recently saw. One actually came in with his girlfriend. She actually lost a pregnancy related to a BV infection. I didn't know that was possible. And so he came in because he wanted to get tested for all sorts of, infections, including STIs. And then I had another patient come in who his girlfriend has recurrent episodes of bacterial vaginosis. He was asymptomatic. She wanted him to get treated because she thought, perhaps that was contributing to her infections. He took some antibiotics and then developed like angioedema or some sort of like penile. Then he developed symptoms because of the antibiotics that he was being treated with. So two very weird scenarios. So I guess I want to start off with, why does this conversation about BV matter to men and women?
Yeah, so BV, or bacterial vaginosis, is basically an overgrowth of harmful bacteria in the vagina. It's very, very common. So over 24 million women between the ages of 14 and 44 experience BV every year. 58% of women will have a recurrence within 12 months. So it's very, very common. Women get treated and then it comes back. The symptoms of BV are vaginal discharge, vaginal odor, discomfort. And about 30% of women don't even know that they have it. They don't really know that they have this infection. But if you probe them a little further, they'll actually admit that they have these chronic issues. Yeah, no, it matters because it's prevalent. It's very, very common. It's the most common reason a woman of that age group visits the OBGYN. So very, very common. And I would say it's something we know how to treat. So we give women antibiotics for this problem, but there's no FDA cleared therapies for prevention. And so that's why it's so important to talk about that.
Yeah, and it smells, and people don't like the way that it smells, and it can impact how, in let's say, a heterosexual relationship, or even in a non-heterosexual relationship, how the partners engage. If your partner has an odor, that's going to change the way you are intimate with that person.
100%. So yeah, BV is interesting because it one of the hallmark symptoms is not only discharge but odor. We know that 20% of women in our studies that we've done, 20% of women are bothered by vaginal odor, and one of the reasons is semen actually causes that problem. So in women who aren't using condoms with their partner, the semen gets deposited into the vaginal canal, and it does two things. So number one is the pH of semen is very high, whereas the premenopausal pH of most women is low. So it disrupts the vaginal pH or acidity. And it also, there's factors in semen that lyse what we call the vaginal amines, and that's what's responsible for fishy vaginal odor.
Yes. So is that where like this concept of like when someone mentions like a fish smell, are they like directly referring to like BV?
Can be. I mean, a lot of times, so sometimes these women come into our practice and they have odor and they have discharge, and we check them and say, "Hey, you have bacterial vaginosis. You need an antibiotic. You need to be treated." A lot of women they end up not having those bacteria that are growing, but they still have this odor. So semen is the primary culprit to that disruption of the microbiome of the vagina that causes odor. So it's not always necessarily an infection, but it plays a role in the odor.
Gotcha. All right. So talk to us about your mission to prevent this problem.
Yeah, so this all started about 6 years ago. I was in a hot tub with a bunch of couples in Jamaica, and
I feel like that's where
randomly,
all good ideas start, in a hot tub in Jamaica.
yeah, so randomly, the woman who was sitting next to me, we had met, after a few drinks, spilled their story to me, and she said, after intercourse with her husband, she gets some discharge and odor, and sometimes she goes to the gynecologist and they tell her she has bacterial vaginosis and they treat her, and other times, she doesn't, and it makes her not want to have intercourse with her husband, and this resonated because I've heard patients say the same thing. And I knew what to tell her was the cause for this, but I didn't know what to tell her about how to prevent it. So explained what I just told you about how semen, causes, odor. It changes the pH. We know that semen actually prevents the beneficial bacteria, the lactobacilli in the vagina, from growing. So I told her all this, and she said, "Well, okay, so what do I do to help prevent this?" And I said, "Well, we really don't know how to prevent BV other than, the CDC talks about using a condom or avoiding sex." Obviously, that was not a good answer for her. Now, long story short, it turns out that her husband was head of innovation at Pfizer at the time. And so he turned to me and he said, "This is unacceptable. You and I have to talk after this." And he had been kind of working on some solutions for a while before that. The two of us teamed up and we started a company to tackle this problem.
Wow, amazing. So what year did you start the company?
This was in 2019, about 6 years ago.
All right. So how has the company evolved in the last 6 years?
Yeah, so it's evolved tremendously. So we started out just with some research. We did a 1,000 patient survey study to find out how many women are bothered by this, and we found that over 50% of women are bothered by post-sex discharge and dripping. So even 24 hours after sex, some women are still bothered by discomfort, by discharge. Over 50% of women are bothered by the discharge. 20% of women are bothered by odor after sex. The next thing we did was we held some meetings with some of the key opinion leaders around the country. So we went to vaginitis experts, we went to experts in sexual health, and we asked them, why do you think this is? Do you think there's an option for women out there? They all said the same thing. This is a big problem. Here's what causes it. It's semen residing in the vagina, and there's nothing out there to fix it. So we held a focus group with some women back about 6 years ago, and we kind of discussed with them, what would you want this product to look like? Would it be, what would it look like? What would it feel like? And a lot of the women said the same thing. They said they like the familiarity of a tampon. So we created a tampon that is the first post-coital tampon that absorbs semen after sex. So it's a little different than a typical tampon. Most tampons are made out of cotton or rayon. They absorb menstrual fluid really well, and they sit in the lower part of the vagina. Ours is made out of a polyurethane foam. So this is kind of what it looks like. It looks like a tulip, and it's got a retrieval string. It's very soft. It absorbs semen really well. It's not for menstrual fluid, but it absorbs semen really well, and it goes all the way up into the top part of the vaginal canal where semen gets absorbed or gets deposited, and it does a really good job of absorbing semen.
So when would a woman put it in and when would she take it out?
Good question. So typically, as urologists, we tell our female patients, listen, right after sex, what you have to do is run to the toilet and pee, right? And that's typically how we instruct women. And the reason why we tell them that is we have a theory that some of the bacteria gets into the urethra, and the urethra is very short, so that they need to pee out the bacteria and flush it out. There's a theory lately that maybe that's not the right reason why women are getting post-sex infections. And it may just be simpler than that, that semen is disrupting the vaginal microbiome. So now what we tell women in our study is have this product at your bedside. They, instead of running to the toilet after sex, open it up, and it's just like a tampon. It gets inserted just like a tampon right after sex, and they can leave it in for up to an hour, although it works really quickly. In our original clinical pilot study, we had several women use it only within a minute, and it works really well if they use it like that, or they can leave it in for up to an hour.
Wow, so this is an alternative to using a towel.
Correct. Yeah, interestingly, so we did ask a lot of women, what do you do? What are your, there's a lot of studies we have in sexual health on sexual pain disorders and libido, and we really don't have any studies on sexual hygiene practices. So we asked those questions, and a lot of the women did that. They said they use a towel, they grab a t-shirt, they run to the toilet, they pee. Some women say they hop in the shower. So what was interesting in our clinical trial is we instructed women to not do any of those things, to change their practices and open up the Livi tampon right after sex and insert it. Interestingly, a lot of the women said that this is a complete behavior change for them now. They love it. So they liked being able to not worry about dripping and not worrying about discharge, being able to cuddle and talk with their spouse as opposed to having to run, to grab a towel or run to the toilet. Really, really interesting stuff.
Mike, this is game changing. And this is going to save the lives of towels everywhere.
It is game changing. There's nothing like it. So we're really excited. It's going to be a new product category on the market. Very, very excited to launch this.
So who might consider using your product?
So really our product, we're submitting to the FDA very shortly. The indication is to absorb semen and vaginal fluids. So anyone who's sexually active, who doesn't use condoms, that's what our product is intended for. We've done a large scale clinical trial. We launched this product to 1,000 women over the age of 18. Interestingly, we thought it would take 3 months to recruit all 1,000 women. In 1 hour, we had 1,600 women sign up for the trial. So very, very exciting to see how many people were interested in this.
That's unheard
Uh,
of.
yeah,
That's
yeah,
unheard of. Yeah.
we were very excited. So yeah, we're submitting to the FDA. We're hoping that any woman who is sexually active who is not using condoms, is really in our target market, and anyone who really wants to protect their vaginal microbiome. In one of our portions of our study, we did pH testing. So we had women check their baseline vaginal pH. Typically, it's around 4 if it's a healthy vaginal microbiome. After sex, the semen causes it to shoot up to around 8. And it takes a good 12 to 24 hours for that to get better. What we were excited to see is that in our pH study, in our clinical trial, using our product dropped the vaginal pH back down to normal levels quicker than the body could do on its own. So as a urogynecologist, that really excited me. We always want to tell women you should have a low pH, and this is one of the products to help them get there.
And what have you been finding in terms of changing risk for developing BV or recurrent BV?
So, I mean, we have those studies ongoing. We submitted for a grant to study it further. We know in our clinical trial, it helps discharge. 85% of women had improvement in their discharge. We know that 75% of women thought their vaginal odor was better. We know that in the women in our pH study, their pH was improved afterwards. So we hypothesize that probably what's happening is it's improving the vaginal microbiome. It's improving the healthy bacteria in the vagina. It's decreasing the risk of the harmful bacteria in the vagina. What we don't know is what's actually happening at the microbiome level, and what are the levels and the amounts of these bacteria. Those are bigger studies that we have to do, and we did submit for some grants to try to understand what's happening, at the biological level.
Mhm. Mike, who is not a candidate for using your product?
So the one thing that we have on our labeling is that this is not a birth control. So we want women to understand this is not for people who are using it to try to prevent STIs. That's not what we're here for. If you're trying to become pregnant, you shouldn't use this. We absorb the semen. If you're trying to get pregnant, you want the semen in the vaginal canal. Um, Anyone who has some sort of anatomical issue, or if they have trouble inserting tampons, may not be a good candidate for this. It's very similar to a tampon. And if you have pain when you insert a tampon, you may not be a good candidate for this product.
Any concerns with any sensitivities?
Good question. So the FDA requires that we do safety studies. I should, again, let your viewers know this is not yet FDA cleared. It's not yet on the market. We're doing studies to work on that. Our products are very similar to tampons. So the applicator is made out of polyethylene, which is a very common material used in tampon applicators. The retrieval string is made out of cotton and polyester, very similar to tampon retrieval strings. The only part of the product that's different is the absorptive unit. Tampons are made out of cotton or rayon, and our product is made out of a polyurethane foam. It's been tested in biocompatibility studies and found to be very safe for human use, but the FDA obviously has to review that before we launch this product.
Mm-hmm. So if I could give you a megaphone, unfortunately, I don't have an actual megaphone, but if I could give you one and you could give your message to, let's say, a bunch of urologists, urogynecologists, and gynecologists, what would you want our colleagues to know?
I want our colleagues to know that there are solutions for female sexual health issues. I want our colleagues to ask their patients about these issues. So, we do a good job of treating the complications of sexual encounters. We don't do a good job of asking about sexual hygiene practices. So I want our colleagues to ask their patients about that and know that in women who have recurrent infections, discharge, odor, that there's a good solution out there.
All right, let me ask you this. How do you ask your patient about their sexual hygiene practices?
Good question. So, we sexual health specialists know about the female sexual response cycle, and we talk about desire for sex. We talk about arousal. We talk about orgasm. We talk about sexual pain. So I ask all those questions. There are some questionnaires that are out there that are validated questionnaires that, we give our patients. And I ask them after sex, I prompt them by saying, I'm doing research on this. And some of the questions that I would want to know is that a lot of women have vaginal discharge, vaginal odor after sex. Do you experience this? What's your typical practice? If you're not using a condom, what do you notice after sex and what do you do? And I ask them these questions, and you'll find that a lot of women are open to talking about it.
Awesome. Yeah, I think, we always assume that our patients will bring up relevant concerns. And if they don't, it's not important. And they assume we're going to bring up the relevant concerns and
Yeah.
we end up missing the relevant concerns.
Yeah, lots of studies showing that despite, many, many women having sexual health issues, a lot of our colleagues don't do a great job of asking the patients about that.
Yeah, I've never asked a patient, what do you do after your partner ejaculates in your vagina?
Well, now you can ask them.
Now I can ask them and now I can give them a tool. So your product, what should people know about the availability of your product right now?
Well, right now, so we have done all of our clinical studies. We've done all our development. We have 2 patents that are pending. We raised money. So our healthcare system is Atlantic Health here in New Jersey. They actually have a venture studio. We are the largest investment in a company that they've made to date. So they asked their clinicians, what do you think? And got really good feedback after their due diligence. They made a large investment. We're still raising money, so we have a lot of physicians that are putting money into our company. Submitting to the FDA shortly. So in the coming weeks, we'll have an FDA submission. Usually it takes about 90 days to kind of hear back from the FDA and work through any questions that they have and any issues that they have with our submission. And then we're hoping to be on market later this fall.
Wow. That could be a pretty short turnaround. So where can people find out more information, especially once your product is commercially available, they can direct their patients to it?
So we have a website. It's LiviWell.net. So www.liviwell.net.
And then will patients be able to purchase this directly from the website, or are these products going to be sold from doctors' offices?
Yeah, good question. This is our 510(k) submission to the FDA is a tampon predicate. It's a class 2 medical device, which means that women will be able to purchase this online without a prescription. We will be partnering with physicians. So a lot of physicians have already told us they want to have these products available in their office to sample to their patients, to tell them about it. But it'll be direct to consumer. You can go on our website, eventually buy it, or through physicians.
Awesome. Mike, anything else you want to share with the audience?
I just want to share that I think it's great that we have physicians who are interested in sexual health and talking to their patients about this. And thank you for providing me the time, and thanks for having me on.
Awesome. Thank you so much for sharing your expertise. And wow, it's so fun to be a clinician and to really innovate the field. You get the best of kind of both worlds right there.
Absolutely. It's fun to be in this field. I love it.